Hi, my name is Dr. John Repole. I want to thank you for watching this small segment on thyroid disorders and natural holistic approaches. The thyroid gland sits right here, and it is a gland, an endocrine gland. And endocrine glands are tissues in the body that secrete chemical substances called hormones. And a hormone is simply a substance that takes information and carries it long distances in the body to create some sort of physiological response. The thyroid controls the way we utilize energy, our metabolism. It controls our growth, our development, temperature regulations. It controls and has influences on our heart, our muscles, our bones, and so forth. So it has a wide systemic range of effects throughout the entire body. Approximately 12% of the United States population is affected with some sort of thyroid disorder. 80% of those thyroid conditions are called hypothyroidism, and that means an under-functioning thyroid gland. The thyroid gland spits out a few different types of hormones. One of them is called T4, which is really kind of like the inactive form of the thyroid hormone, and T3, which is more of the active form. So with hypothyroidism, you have an underactive thyroid, so a decreased production of T4 and T3. And the other 20% of diagnosable thyroid conditions in the United States is something called hyperthyroidism, and that would be an overactive production of the thyroid hormones T4 and T3. So some of the signs and symptoms that you would see associated with these two conditions is with hypothyroidism, you would have dysregulation and cold intolerance. You would have fatigue. You would have problems with increase in weight or rapid weight gain, unexplained weight gain. You would also have, brittle nails and thinning of the hair. And there's more. With hyperthyroidism, you're going to get an increase in heart rate, irritability, anxiety, and these are just some of the many different types of symptoms that you can get with hyperthyroidism as well. The causes of either hyper or hypo are many. There's a genetic predisposition, there are nutritional issues that could be present, past exposure or radiation therapy could also have decreased the function of the thyroid gland. But the most common reason why people have thyroid related issues is due to autoimmunity. Hypothyroidism, we would call that Hashimoto's, and with hyperthyroidism, we would call that Graves' disease. And autoimmunity is simply the body's immune system is looking at tissue in the body and viewing it as a foreign invader and begins to attack it. So in this respect, we would have the immune system is recognizing the thyroid gland as something foreign and begins to attack the tissue. And as it attacks the tissue, it decreases, in the case of Hashimoto's, it would decrease the function or its production of the thyroid hormones. The problem here is that most of the thyroid conditions in the United States are treated from what we call a replacement model of endocrinology. So you go to the doctor and usually they only run, say, TSH, which is called thyroid stimulating hormone in the blood work. And what happens is if they find out that you will have the signs and symptoms of objective findings of hypothyroidism, they'll go ahead and they will give you say either Synthroid or Armour, and they'll do a replacement model. So your thyroid hormones are low, we're going to give you the thyroid hormone. And in the case of hyperthyroidism, your thyroid hormones are elevated, we're going to find ways to suppress the thyroid. The problem is that it's much more complex than that. We need a multidimensional treatment plan that's not just the single antidote of doing some sort of drug intervention, because that's not the whole picture. So as an example, the thyroid gland is pretty complex. We have a signal from the brain that goes to the thyroid to stimulate thyroid production. The thyroid gland itself needs nutrients and substances to kind of help create the thyroid hormones, one of them being tyrosine and iodine and so forth. Once the thyroid hormone produces some of the hormones, most of what it produces in the thyroid gland is the inactive form. The T4 gets transported transported to the liver, where there's a conversion into the active form. It gets transported into the gut, which helps with conversion into the active form, and other peripheral tissues help with getting it activated into the more active form of the thyroid hormone. And to top it off, the adrenal glands, if your body's under stress, will influence or inhibit the conversion of the inactive thyroid hormone into the active form. So we need a multidimensional treatment plan, because we need to be looking at the brain-thyroid communication. Do you have enough nutrients for the thyroid gland? Is the liver functioning properly? Is the gut functioning properly? And so we want more of a comprehensive type of treatment plan. And in fact, because Hashimoto's is the #1 cause of hypothyroidism in the United States, we have it all wrong, because we're aiming the guns at the thyroid gland when really the issue is not a thyroid condition. It's really an autoimmune condition. We need to be addressing the immune system. So first thing we need to do is really get the right type of diagnostics to find out what's going on with the thyroid gland. You need a complete thyroid panel. You need to include the thyroid antibodies, looking for whether it's Graves' or you're looking for Hashimoto's. And then you dig a little bit deeper, and perhaps you're having GI disturbance issues, so maybe a complete digestive stool analysis might be in order. Why? Because conversion of the thyroid hormones in part happens in the GI system. Are you having problems with liver detoxification? Again, why is that important? Because conversion happens there as well. Is your body under an enormous amount of stress? We may need to be looking at a blood marker called reverse T3, or what we call an adrenal stress index panel, to see if you're getting influence of the adrenal glands and stress-related hormones like cortisol on the inhibition or conversion issues of the thyroid. So as you can see, we want to move away from the replacement model for thyroid treatment into more of a functional approach, more of a holistic approach that's going to include diet, that's going to include exercise, so diet and lifestyle changes along with the right type of functional testing in order to treat the cause and not the symptom. I invite any of you who are suffering or think you might be suffering from thyroid-related conditions, to contact our office and set up a consult so we can talk to you more about what you can do to help with the holistic treatment options for your particular condition. Thanks so much for listening to the short segment.